Mr. President, members of the Senate, you know, we have this important measure before us, and it seems hard to believe we can't seem to get our hands around what we're actually doing. The author of the bill says this isn't Medicaid expansion. First of all, if you do a 115 waiver and you cover, 10,000 homeless people, you're helping expand Medicaid to cover those people. This is a Medicaid expansion. This is adding people to Medicaid. Now, we don't know, and that's a problem to all of us here. We don't know what we're doing because we could be putting a plan forward that doesn't cover the 240,000 people that are under 100% that are not presently covered. We could be having a plan here that excludes many of those people for various reasons, work requirements or other situations. And so we could be doing a waiver plan that covers 15,000 or 20,000 or 30,000. That's problematic as a legislative body that we don't know what we're doing. Second of all, we're not being honest about what we're doing. That's problematic. You know, I come down here saying to all of you, and I want Medicaid expansion. I want to cover as many people as possible. And people will say to me, well, Steve, the chance to cover 200,000 is better than no chance at all, or not covering anyone. You want to cover these 470, 480,000 people that would be under a full Medicaid expansion. But why can't you support covering possibly 200,000 people? It's better than nothing. You know, and we saw in committee, we saw the Hospital Association and the nonprofit hospitals come down and support a bill, say they were for this, because something's better than nothing. But I'm here to tell you today that A, the author of the bill stated that we have 115 waivers in, we do. And there have been many approved. To clarify the question from the senator from the 6th, we're talking about the 90-10 match. And up to this point, no plan has been approved for the 90-10 match up to 100%. And if you don't get the 90-10 match, then this is folly. This is a bad plan. This is like Utah's proposal that would have covered 48,000 less people but pay cost 50 million more. That's the road we're going down. And that's not where we should be going. You ask why, myself or others might oppose this. We have history on our side. We saw a plan that put more people under health care coverage and it be vilified and attacked from the moment it came forth. And we saw hypocrisy in the last election where we saw candidates all over the country, attorney general candidates, congressional candidates, some that were signed on to federal lawsuits trying to do away with pre-existing conditions. We saw them get on TV and say, well, we always wanted to cover a pre-existing condition in the middle of a campaign when they were on a lawsuit to do away with it. That hypocrisy strikes home to many people in this room and worries us about where we're going with health care, especially when we have no guarantees we're going to get what we're asking for, and we have no guarantees even what we're asking for because we're not guaranteed to go to 100% of poverty. It's may, not shall. We had an amendment that would have made it shall. We're not guaranteed to not put onerous restrictions to keep it even lower. That's problematic. And it's one reason I oppose this bill today. You know, we as a body will try to do the best thing for the people of Georgia. And today's bill is not the best thing. If we vote it down, are we out of luck? No. We have Senate Bill 36, House Bill 37, that would be a full Medicaid expansion that could cover more people and do a better job. But let me go on a little bit more with the history of this bill. You know, last session we had a Medicaid expansion bill in. The session before we had a Medicaid expansion bill in. They never got hearings. I had Senate Bill 36, Senate Bill 106, no hearing. I do not care what the chairman of that committee states. That committee was one of the least open ones I have been at in my nearly 30 years in this body. I spoke for 2 minutes about the bill, commented, made some comments, and the chairman said I was proselytizing and shut me up. Senator 36 tried to make a comment. He quieted her. You know, I wanted to ask questions from the people presenting. You know, I went through days of a broadband bill where EMCs came and talked to the committee, and I asked them questions. Municipal Association came and talked to the committee, and I asked them questions. One of the most important measures we've got this session, and was I or any member of that committee allowed to talk to the people that testified, whether it be the Georgia Budget and Policy Institute that had troubles with this bill, or Georgians for Better Health, or the Hospital Association, who had supported full Medicaid expansion, although they said they supported this. I put to you that they'd rather have full Medicaid expansion. Or other groups. We didn't get to ask them questions. We didn't get into detail because that wasn't the purpose of that committee. It wasn't to vet the bill. It wasn't to improve the bill. It wasn't to have a hearing on the bill. It was to ram the bill through. And the reason we're ramming it through, without parameters or guidelines on what we're doing, is so that the governor's office can get a $1.6 million, plus a match, $2.6 million, amount of money for a Medicaid waiver plan, and not even have it ready for us next session so we can see what we're doing, so that if we didn't like it, we could respond. The timeline in the bill is June 30th of 2020. So you can get out of here after the session before it's released and claim no responsibility in your reelection campaigns. That's what we're ramming through today, and it's problematic. You know, we can look, when we talk about subsidies under Affordable Care Act, and we're talking semantics about whether or not you do have subsidy. I think you do have subsidy if you're in the 100 to 130 range under the ACA. But if you're making, a family of three is making less than $28,000 a year, the only real course, the real option to have health and care is to be under the Medicaid expansion, because you don't have the financial wherewithal to get decent plans in the private marketplace. And I won't go in at length. I know other people want to talk, but the 1332 waiver is also disconcerting, because right now we see that there may be efforts. When we talk about high-risk pools, and we've been talking about it for years. I had it in a brochure years ago talking about a high-risk pool and creating it. You know, it can help an insurance marketplace. But the trouble is you have to fund the high-risk pool. If you put a lot of people with bad health conditions, if you put all the cancer people in a high-risk cancer pool, it's going to cost a lot. And if you're a normal person, you're not going to be able to afford it. So it has to have a lot of public funding to fund. And we're not talking about where that's going to come from or how much money we're going to spend. You know, you can make, under the 1332, there are concerns that we could make some plans cheaper by changing the coverage guidelines, but make the coverage not sufficient to help you when you're sick. Or to make those plans get rid of some of the more sick people by a high-risk pool, but then other people can't afford the coverage because we haven't built the mechanisms in place. The House Ways and Means Committee stated that the Trump administration actually may be moving to try to allow states to reduce coverage in some cases. For some people, increase costs. For some people, reduce costs. You know, there's concerns, a lot of concerns that we have that we're not going in the right direction here. And I want you to understand that we know that if we do full Medicaid expansion, we will bring almost $3 billion to Georgia in medical and federal dollars that will help our businesses and create 56,000 jobs. We know that everybody under $138,000 a year, 138% of poverty, are people who need help to get insurance. And those people making between family of three, I'm not, you know, single person, family of three, if you're making 20, 28, you're working. You're making money. These are not, if you will, deadbeats. These are people trying to make it. And to us as a society to make sure they have health insurance, I think is an important important social good. Ladies and gentlemen, today, as others will come up and talk about, this bill doesn't have safeguards. It doesn't have a backup plan. But more importantly, as we as a deliberative body decide what to do today, we should have had a bill that had flexibility in front of us so that if the researchers and the people developing our waiver plan went and said, can we get a 9-to-1 match up to 100%? And they said, no, it's going to be 2-to-1. And I'll tell you right now, if it's 2-to-1 and we only go to 100%, it's going to cost us more money to cover less people. And I don't think Kempcare, I don't think this plan should be a plan that covers less people for more money. And we should also make sure that guidelines are in this bill for the 1332 waiver that protect people, to make sure that our values are in place. And I don't think that's there. I know there's other speakers, so I'm going to yield the well. I will yield for questions if necessary, but I know other people want to talk. I could talk about this for a long time. It's been a frustrating process, and frustrating today that even the concept of the bill itself, whether we're expanding Medicaid or not, is being disingenuous, because this is Medicaid expansion. Isn't ACA 138% Medicaid expansion? No, and that is a big problem. I yield for questions if there are.
You have no questions. Chair recognizes the senator from the 22nd.
Mr. President, but my light has been lit because I wanted to ask the Senator Noel questions. Is it not showing up on your panel?
I see you recognized as to request to front on my screen.
I'm sorry, I have both lit up.
Would you like to ask a question?
I would.
Do you yield, Senator?
I yield.
Thank you, Mr. President. With Senator Yield?
I yield.
Senator, I've heard you talk about a lot of different issues, and I just wanted to clarify a few things.
Thank you.
You mentioned $1.6 million. That's money in the budget for consultants. Is that correct?
Thank you. I'm glad you brought that up. Listen, we did not vote, or the Democratic caucus, myself, my colleagues did not vote against a supplemental budget that included $1.6 million for consultants on this Medicaid plan. You know, we want, research done. We want information. $1 million match will come from the feds. We weren't against that. Thank you for your question.
And Senator Further Yield?
I yield.
Senator, is that money being earmarked to develop a strategy on how to move forward with the expansion of Medicaid?
It is my understanding that the administration wants to get experts, that they now want the power that they took away prior to a gubernatorial election, was taken away from the governor's office prior to an election some years ago. They want that power back in their house. They want the department to be able to hire the best and brightest minds to work on a waiver plan, and that is why they're requesting the money.
Senator Further Yield?
I yield.
Senator, given that we've already allocated money for the consultants to come up with an expert plan, do you think it would make sense if we delayed action on this bill until we got the results of what those high-paid consultants would consider is the best plan for Georgia?
I certainly think that that is a possibility that we should look at. We could, I would like to move forward through my bill, Senate Bill 36, of course, but we could wait until we have this plan at hand next session and sign off on it, make adjustments or give legislative input, and then have a waiver plan by June 30th, 2020.
And I'm sorry, Senator Further Yield?
I yield.
Senator, I heard you mention that this plan and this bill does not have a backstop on it. Are you saying that if the state of Georgia is not approved for these waivers, then in fact we are back to ground zero again?
With the history going on on this item, you do have to worry about the politics. And the fact that they won't allow the latitude to go up to 138 if they think it's the best course for Georgia in this plan that we submit does create a situation where if we reduce the 2-to-1 waiver, we go the 9-to-10 match, we could be ending up going forward with a plan that costs more, covers less, or no plan at all. We don't have to submit it if we don't think it's acceptable. So I certainly agree with that concept that we're not allowing the broadest pass to get the best plan, and if they fail to get a good waiver response from the federal government, we could have no plan at all, and this could be effort and futility trying to cover these people.
Thank you, Senator.
Thank you.
You have no more questions.
Thank you. I'll also comment the senator from the 10th had an amendment that would have brought us up to 138, so we could have that latitude.
Chair recognizes the senator